Thank you very much for that presentation. Thank you for both presentations, actually. So at this point, we've got an opportunity for questions and comments. If we have some questions or comments, please go to the microphone. Ruth, you're there first. Go for it.
So my question was whether or not there has been a good workforce needs assessment to inform public health, education, curricula, the pedagogy that's actually done. Do we have a good needs assessment from the workforce that's been done?
If you're asking about that in the Minnesota Health Department, certainly not. I mean, it's just an awareness that there's a clear need. And like, for example, the local public health agency, Minnesota is separate, the state agency is separate from local public health, which are county employees. And when they heard that we did a workshop, they immediately, oh, we need that so badly, couldn't you do that for us? And we've thought about, just going out and doing regional workshops, but we're not even necessarily the right people to do that. So it's not just an assessment of what's needed, it's also having the expertise to be able to identify that. And it's one of the things that happens, I mean, because of, like from the Center for Health Promotion, our budget used to be about 10 million, it's down to 6, and expected to probably going to drop even more. So trying to bring on expertise for something like health literacy is a very difficult sale right now.
Olivia?
Yes, I certainly would like to respond to that, because as part of the accreditation process, all the schools and programs are supposed to be doing a needs assessment from those potential employers, et cetera. And they're supposed to check in with their alumni to find out, once they get out there in the workforce, do they feel like they had the skills that were required to make things work. An example, we had Genevieve Martinez, who just came and talked. She's a graduate from a couple years ago from our Department of Behavioral and Community Health, and it was a specific question we asked when she came and gave a seminar at a school. What do you feel like you needed to really fully function? She said a couple things. One is that she recognizes that people are not well prepared to work in low resource areas. And so what ends up happening is they learn, for instance, qualitative software such as NVivo, and they get out there and their institution cannot afford to pay for that software, okay? I saw the example earlier about one of the softwares, and they said that the computers weren't capable of running the software. Okay, so she said the students aren't prepared for that. They learn about like the best way to do it, but not necessarily what people are going to encounter when they get out there. The other thing that she said, which I thought was very important, is that we need to figure out how to take our technical jargon, our research findings, our methods, et cetera, and boil it down into a way using diagrams, et cetera, that people can understand. It's not just, right, it's not just, we're not just talking people of low literacy. I mean, even our parents who might have graduated from high school still might have difficulty understanding what we do on a regular basis. So it is officially part of something that should be done as a part of the accreditation process. But as I said, talking to people who are part of that review process, they look to see whether the big picture's there. They're not getting into the weeds. They look to see whether that assessment's being done without necessarily pulling that information out.
Jennifer.
This question's for Don Bishop. Since last spring, when you had the workshop, have you received any pushback? What has been the effect on your center? And also, has there been any impact on other departments or areas within your state health department?
Well, not as much has happened as we hoped. Part of that we've looked at, with Charity going on maternity leave, and we weren't sure with Janelle whether we'd be able to hire her, and we finally, that went on for a couple months, and so now she's here. I think when Charity's back, we'll have the two of them, because they're really the people who are the advocates within the department. But I think the other thing, though, is like right now with the this white paper that we have to write for the legislature for the next session, the fact that I'm going to be writing a large part of it, and Mary Manning, who's our chronic disease director, is also responsible for a big piece of it. So, together, I think there's an opportunity there to build that in. I think relating it to social determinants of health and making that case is something that's really needed. The other thing that I think, there is an awareness now that we've continued to, I think we've raised the mindset for health literacy within our division, and also with the Office of State Health Improvement, which is right there with us on the 4th floor. And they have a real opportunity going forward because despite the hard budget times and everything, somehow the legislature awarded them $20 million a year to do community health programs. And so they're out there in the community, I mean, providing technical assistance. Those grants have just been awarded. And so being able to build more of a health literacy focus into that could be a real opportunity.
Thank you. Patrick?
Patrick McGarry, Roundtable member. I guess this question's for both, but probably more directed at Olivia. Do you think CHES certification for health educators pays enough attention to health literacy, if at all? And in the patient-centered medical home environment, many times health coaches or wellness-type people, public health educators are employed to translate for patients. And do you think this is a really appropriate model or should be more incorporated in the overall practice?
Okay, I'll try to tackle one question at a time.
Yeah.
The first is about one particular program for credentialing, CHES program. I don't have a CHES credential, so I'm not going to speak specifically as to what's required for that particular test. But I can tell you, just taking a look at what's used for the CPH exam, the Certified for Public Health exam, they examine so many things there. So you probably would say it's not sufficient in regards to health literacy. I can just say even the bare minimum, that diversity and culture requirement for public health programs, I don't think we're doing a good enough job about that. So I don't think all of our students are getting that kind of exposure, and they certainly can. That's something that all of us could have a role in our public health programs.
And then the health coach part.
And in regards to the health coach, if you could repeat your question.
Well, do you think that's the optimal person in a patient-centered medical environment? And many times health coaches are public health or health educators who are trained in public health programs. Do you think that's the optimal person to be promoting health literacy in the practice?
Well, you know, it's interesting. When you look at definitions for cultural competency, they talk about processes, they talk about systems, and I think that's what we need to talk about health literacy. We need the entire system to be responsive to health literacy. We can't focus on just one discipline as the one who's responsible for carrying the water for everybody. So I would argue that everybody in schools of public health, for instance, and all of our public health workers, which would include people who are not health educators, should be exposed to health literacy and understand how that fits into the work that they're supposed to be doing.
Don, do you have it?
Okay.
And this is for a non-health literacy person speaking.
One thing, the workshops that when we did the workshop, there was a great deal of variability in how much people brought to the table in their understanding or grasp of health literacy to begin with our staff, and we required that everyone be there in the center. The others were more like from Refugee Health and from the Office of Minority and Multicultural Health. It was optional, but most of them came anyway. So there's, I don't know, I think I'm losing the question, but it's just, yeah, the thing I guess I have trouble because I think that what's really needed is for that new document to come out from the Institute of Medicine that broadens the scope of what health literacy is to really motivate its incorporation into what we do as a health department. I think nothing like working with ASTO would be a great avenue if I were to partner there, you know, because they have the health officers there. They can come back and say, this is what we're going to do, you know, and we need that kind of support to make it happen.
Right. Well, up there too. Go ahead.
Rob Logan, National Library of Medicine. A couple questions. I guess they're more for Olivia, but either one of you are free to talk about them. It was interesting to hear about the entry of health literacy-related curricular materials in schools of public health, because to me the fact that it's not an emphasis explains many of the things we've talked about today. Okay. If it was an emphasis, if that was something that people had been exposed to for many years in their education, I think we'd be having a totally different conversation about many things. Okay. By the way, if you're free to disagree with that, if you choose to, or you're free to expand upon it. The other thing is, several of us have noticed that there are undergraduate programs in universities that do not have a school of public health, where they're beginning to introduce a cluster of courses on health literacy. often that are open to pre-professional students and even open to general education undergraduates. Curious if you came across that in doing some of your work.
Yes, I thank you for that point. We do have public health programs that are outside of schools of public health. In fact, there are many undergraduate public health programs that are outside schools of public health. I didn't have a chance to mention it. I had written on my notes and forgot to mention it. Somebody, when reaching out to my colleagues to say, hey, I'm giving this presentation, I'd love your thoughts, share with me what you would like me to share with IOM. One of the questions that somebody asked, Rachel Widom asked, that I thought was a great question. She said, are we interested in increasing, improving the health literacy of the students themselves? Okay. And I thought to myself, well, this is interesting, because when I went to look and see the presentations that were made this year at the American Public Health Association, one indeed was about how to improve, for the undergraduates, how to improve their health literacy, improve
Correct.
their ability to search and understand health information for themselves or for the loved ones.
Correct.
So that's kind of an interesting take. At a minimum for our students, we should make sure that they have those skills when they leave so they can take care of themselves personally as well as their loved ones, right? And those of them who are going to be involved, obviously, in health education, but ideally all of the students should understand the next piece. What can they do to help improve the health literacy of the populations in which they're going to be serving?
Well, just to speak up for a second, there's several roundtable members who are looking into health literacy efforts in K through 12 and higher education, and we had a conversation about that exact issue about 3 weeks ago, and looking for exemplars. The only thing I can say is that as we go through the work and continue, any suggestions you have about undergraduate curriculum that you think are exemplary, not necessarily in health literacy, but in related fields, whether or not the emphasis is the traditional one or the one that you just cited, okay? We'd certainly be interested in hearing
I'd be
about
happy to give you the information of the students who presented about this at APHA.
Very good,
Yeah.
thank
So
you.
the two of you should connect.
Yep.
Good.
Okay. Linda?
A comment about how easy it is to miss an opportunity. A story here that I was appointed as one of the people developing competencies for the Association of Schools of Public Health a few years ago before they put out the latest version. And when I came into the process, I was a little bit into it. I noticed that there was nothing about health literacy. There was cultural competence, there was communication, and so forth. So I began to lobby for that, and I want to give a shout out to Cynthia Bauer at CDC, who was a big help in getting that. But I wanted to mention it was a hard sell to get people to say, they say, well, we only have so many competencies. And to note the place of that. So I think there are a lot of places where we could miss opportunities. I'm thinking right now of the rise of the accountable care organizations. A lot of interest in among health plans with the Affordable Care Act in showing that they're actually doing better. And what I've noticed in a lot of these accountable care organizations, there really is not a focus on health literacy and those kinds of skills. So I don't know the way to organize ourselves to be sure we're at those tables when those competencies are being developed. But there are a lot of those opportunities that we probably could miss.
Thank you very much. One of the things that we have struggled with, at least in the state of Maryland, is recognizing that when we're trying to bring health literacy into the dialogue, folks don't want to see another set of competencies. They feel like they're struggling enough trying to cover the material that they're required to do. So what we ended up doing is bringing together a draft set that Clifford Coleman was working on that now he's recently published. And we also brought from the tool for assessing cultural competency training from the Association of American Medical Colleges. And we sat down and rolled up our sleeves with a group of experts and came up with a core set that encompassed both of those concepts. So the roundtable members do have a copy of that, and I'm happy to send anybody the link if anybody's interested in looking at that much shorter set that includes both concepts.
One thing I'd just say, I mentioned the Many Faces Conference in Minnesota, and I think that's been going for 20 years, and it's more well attended each year. And I don't know if other states may have something similar, but that's, I think, a tremendous opportunity to, especially with the Affordable Care Act changes, and they're trying to figure out how to deal with that. And the frustration they're experiencing, like working with immigrant communities, that I think they'd welcome some kind of training as a part of that conference, and extend beyond that.
Very good. Let's please join me in thanking this panel.